All right, good morning and welcome to the next version of our state legislative candidate forums. Today we're visiting with Senator Tony Vargas, a legislative incumbent candidate from District 7. Thank you, Senator Vargas, for joining us for our virtual candidate meetings today. My name is Gina Ragland, and with us today are lead AARP advocacy volunteers, Susan DeCamp, Bob Lassen, Danny DeLong, and our state president, Dave Holmquist. Senator, we appreciate your taking the time to meet and discuss issues of importance to the 50-plus voter in Nebraska. And as a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. So just jumping right in, Senator, if you want to start us off by giving us a little background about yourself and your campaign. We're targeting 5 minutes or less to do that. That would be great. And then we'll move into some of the questions that we have at hand. So with that, go ahead.
Yeah, no, thank you. And thank you, everybody. And my name's Senator Tony Vargas. I was elected in 2016. I don't come necessarily from politics, although I feel like I've been in it for a while. I've been in the state of Nebraska for the last 8 years, and I've been in elected office for the last 7, which is it surprises me because I never thought I'd be in this world. I previously served on the Omaha Public School Board for 3 years, and then now served in the Senate for 4 years. But I started off my career as a public school teacher in New York City and an AmeriCorps member. My family is born and raised I'm born and raised in New York. My family's from Peru. I'm first generation here. And that's all important to me, my teaching background and my family background, because it's the reason why I do this work. There are marginalized populations all over our country, and they seek out and they look for elected officials like myself to stay really grounded in whether or not policy is working for the public. And that is the constant North Star that I've been trying to do. It's one of the reasons I ran in the first place, because I have, and in District 7 in downtown South Omaha, the most diverse district socioeconomically, racially, age-wise, that you'll see. It's downtown Omaha. It's the South Side. You have everything that you might need in terms of racial, ethnic, age distribution, socioeconomic. It exists in my district. And so these last 4 years, I've tried my darndest, and I'm going to keep trying, hopefully, if I get reelected, to do as much as I possibly can to follow through on what I said I was going to do, which is ensure that we're creating a higher quality of life for our families, protect and increase healthcare access and quality for all of our most vulnerable populations across our state, and specifically in Omaha as well. Making sure we're increasing our education. Our education system is meeting the needs of all of our populations, no matter where you are, what zip code you live in. And then ensuring that we're creating opportunities for people to make sure that they can have a job that's fulfilling and that meets their needs, and we're getting people into the right sectors and making the right jobs so that people can be in those sectors. And so that's what I've been trying to do. I've been on an appropriations committee for the last 4 years. I see the appropriations in our budget as a moral document, which means I'm not necessarily just about cutting or about spending. It's about where we spend and making sure we're investing in our people. And that's all across the timeline from birth through when people leave us. And so, and then I also serve as the chair of the Legislative Planning Committee, and that is our strategic planning for the state of Nebraska. So I care about looking at data demographics to make sure that we're meeting the needs of our state, and not for just saying this because it's AARP. One of the things that we've looked into is the population over 55 and what the challenges they've been facing across the state, and where we need to then make our long-term investments as the state is needed. And we've been doing a lot of data reports and trying to educate our body on that, because sometimes it gets lost in translation, what that actually means to be over the age of 55. We have one of the most productive top 5 people over 55 still working across the country. And there are just a lot of opportunities to try to make sure that we're meeting the needs of your members. And I'm just really dedicated to continuing to be a thoughtful legislature that's data-driven and that focuses on the people that are the highest need. And so that's me. And I appreciate you asking the introductory question.
Thank you, Senator. And we do appreciate all your work that you do on the planning committee. As the chair of that, I know you're very instrumental in a lot of that data and working with the University of Nebraska, Omaha, and so forth. So we do appreciate that. Just moving in quickly then, we have provided you with a set of 3 questions that were pertaining to what we feel are important things to the 50-plus voter in Nebraska. We have allotted 5 minutes for each of those questions, and the volunteers around the table here will ask those questions. The first question pertains to helping people stay in their homes and communities, and Dave Holmquist, our state president, is going to take that. So go ahead, Dave.
Good morning, Senator Vargas, and thank you for joining us. A livable community is one that is safe and secure, has housing that is affordable, in other words, no more than 30% of household income spent on housing, transportation options that allow individuals to travel by multiple means, and supportive community features and services for people of all ages, which allow people to remain in their communities as they age. What steps will you take to ensure that all Nebraskans have access to livable communities?
You know, livable communities is something that we've talked about, and by we, my team and my staff, for some time, because I think what we're seeing across the country and what we see across our state and different pockets is that it's becoming harder for individuals over the age of 55 to then be able to then be in their livable community. And there are a lot of barriers to that, and things that we've worked on and things that we're going to continue to work on. We've worked on making sure that affordable housing opportunities are continuing to increase across the state, because we know that making sure that housing opportunities continue to stay affordable and that are healthy and safe homes, which seems like a bit of a misnomer. We have a lot of homes that are older housing stock that are actually not healthy for individuals in those communities. So we want to create some new housing opportunities for individuals. With those, it also means doing rehab, making sure we're increasing the housing that people are living in, that they spent their lives investing in. And so that's what we've been working on as well. We've continued to work on increasing the different housing opportunities that through the Affordable Housing Trust Fund and other different bills that we've passed, so that we're creating housing options and increasing the types of different programs and public-private partnerships that are creating these opportunities in communities, because too often people are being forced to make decisions to move to different places because they're either priced out of their communities, which is a problem, or they see themselves not getting the value they need from their own community. And we want to change that. And so we're going to continue working in the education, in the educating space of housing. You know, yesterday I was meeting with the new NYFA executive director who just got hired about a month ago, talking about housing opportunities in our lowest income and our most highest vulnerable areas across our state, both urban and rural. And we talked about what are the different populations that we need to be worrying about, that we need to be cognizant of. And people of color, people that are over the age of 55 came up, and then like teachers and nurses and others came up as populations that we wanted to focus on. Livable communities to me also means ensuring that transportation options are available. I actually served on the Metro task force searching for the new executive director. So Lauren Senchik is the new executive director for the Metro in Omaha. My questions to her, and one of the reasons why we picked her, is because we have an opportunity, and for those of you who live outside of Omaha, I apologize, but one of the opportunities we have in Omaha and the bigger metro is to expand our regional transportation system. We have innovations like Orbit, but transportation has to be more affordable to individuals across our communities. And a great public transportation system is usually equated with great cities. And so at least in my urban area, I've tried to commit to making sure we're doing more of that. And I will look to continue to look at how transportation can be an access point in our communities. I would say the last thing for livable communities is that we need to make sure that we're doing everything we possibly can, so that I know gentrifying is a really hard word. And it happens. In my community, I'm literally looking outside my home. I have a $70,000 home that's right here next to my house. And they got a new apartment buildings down the street, condos that are selling for about $375,000. Like it is not far. And this homeowner, who's a friend of mine, Louise is worried about her housing costs going up, her property taxes going up, and what that's going to do for the neighborhood, pricing her out and potentially losing options of small businesses and community entities that are in her neighborhood to be affordable. And so the only way to get around that is making sure that there are opportunities and incentives for different types of housing opportunities and entities and protections also for her home to be in place that make sure that we're not pricing her out. And it needs to be thoughtful collaboration with other municipalities as well. But those are the things that I want to commit to doing, because I don't want Louise to have to move out of her community. She waves to my daughter every single day, and she's been here her entire life, and so has her family. So those are some of the things I want to make sure to continue to work on and carry through. I don't think there's something widely innovative. It's making sure you're committing to how we make sure that Livable Communities is living out throughout all the legislation that we could potentially introduce.
Great.
Thank you. Thank you very much.
Our second question will come from Susan DeCamp on health, caregiving, home, and community-based care. Susan, go ahead.
Good morning, Senator Vargas. Caregivers help older people live independently at home by providing assistance with activities such as bathing and dressing, and also performing complex medical and nursing tasks such as administering medication and wound care. Caregivers often provide these services with little or no training and a lot of times little or no pay. Will you support helping caregivers with paid leave, respite services, telehealth, and access to education and training? And also, how would you protect or expand paid services and supports, as well as the financial security that allows more seniors to live independently in their homes and community?
So, absolutely, yes. I have, sometimes when I do these candidate interviews, I feel like I'm touting what we've done, but most of what I've served, my service in the community, living on the appropriations committee, has been the way we spend our money has to be in how we invest in our people. And that's not just in individuals that are, that could potentially need work. This is also for individuals that are, we know are, like what you said, there's caregivers that are supporting individuals, and for people to live fully independent lives doesn't mean that they don't need the supports and services that you described. It means they actually need more of it so that they can become more independent and lead fully functional lives into their late years. And so I wholeheartedly would support, funding the resources to make sure that, caregivers, in-home care, any health care that is being provided to individuals over the age of 55 and our more vulnerable populations across the state are in place. I think it's a missed opportunity in a lot of different ways, because people's well-being has to come first. I think about that for my own family and my own parents, and my mother, who is 73 and is still working like so many people right now, because she loves to work. She probably doesn't need to work. She loves to work. She still works about 30 hours a week. And, at some point, I know that she'll need some necessary in-home health care. So, you can, and I think my record has been on championing issues with not only resources, but, rates within Medicaid, to make sure that we are keeping up with the egregiously, the pay per hour for the services that are supporting our people is not where it needs to be. We've continually tried to increase our rates through either rate studies and legislation or rate studies through departments and agencies. And we'll continue to do that because it's just the right thing to do. The turnover that we see in the sectors supporting the people that your members that you represent, is high. And when we have high turnover in that sector, that means the quality of care is less. And that's hard, because it's not just the services, it's also the consistency of faces and the relationships that are built with individuals. And so when you lose that, very similar to how we have teacher turnover, the same thing affects, I don't see it as any different. And so we need to invest in that as well. So you can count on me on that. Yeah.
Okay, thank you.
Senator. And our last question will come from Bob Lassen, and it addresses nursing facility quality. Go ahead, Bob.
Thank you for being here, Senator. An estimated 6,600 Nebraskans reside in one of Nebraska's 211 nursing homes or long-term care units. By 2040, the University of Nebraska, Omaha projects that that number will more than double to about 14,000. Through a variety of factors over the past few years, Nebraska has witnessed a decrease in the number of available facilities, whether it's financial incentives that they don't have or just costs, and particularly in the rural area. How will you ensure that Nebraskan residents receive quality nursing home care, including ensuring an adequate workforce, education, training, and proper reimbursement?
One, I'm going to continue to, we need to try to continue to look at our reimbursement rates and increasing those. I've been with Senator Stinner on this. Like it pains me that we've continued to consolidate, inadvertently, but somewhat purposely, consolidate our nursing home and long-term care facilities by, doing some more of a private incentivized system through Medicaid. And we need to make sure that we're not doing that. I sit when we were meeting in our planning committee meetings and we're looking at the changing demographics. And yes, our population is getting older and it's becoming a larger percentage of the pie. And that's not changing here for the next 20 years, to your point. It's going to continue to increase. So to think that we can continue to cut corners and cut costs on the cost of the people doing the work and supporting your members in this population is extremely short-sighted. So we need to invest in our rates and our reimbursement rates. We need to invest in our workforce, which means making sure that we are creating pipelines to these opportunities. And then also make sure that these pipelines to these opportunities are not only clearly available to individuals, but that those pipelines are meeting the needs of people to live livable wages and can make it sustainable work. All work that is human-centered is inherently stressful, and that it means that we need to make sure to create some more wraparound opportunities for the people that are receiving services and those that are giving services. And we do need to, as a state, and that's one of the things that I want to continue focusing on, is the fact that we're not investing more in our long-term care facilities is just doesn't make sense. It makes no sense pragmatically when we're seeing the growth in our population. We need to make sure that we are investing in the infrastructure that is meeting the current needs of our population, and it's just not. So I'm going to be trying to do that more as a planning chair. And the last thing I'll say in regards to that question is there are going to be opportunities here over the next 4 years on whether or not we prioritize spending cuts. And that's going to be really difficult. We passed legislation this last year that I think prioritized property tax relief. And that means that there's going to be less funding across the state for the things that we make sweeping generalizations, but I think we align on most things. And aligning on these things means that we are protecting people. And so there's going to need to be a coalition of senators, and I will be one of them, that makes sure that we're protecting our nursing home facilities, our long-term care facilities, so that we're not further being short-sighted about the needs of our state and making it a much more privatized, competitive system that is a disadvantage for your members. It is, and I've had these conversations with Chairman Stinner beyond so many times on just because we're seeing the closing of the facilities all over rural Nebraska, and it's just. Anyway, sorry. It upsets me. It upsets me. Yeah. So talking about it upsets me too. But so yes, like I'm going to continue working on that. And I think it's not policy at this point. It's the people that are well, unfortunately, it's the elected officials that are willing to stand up and say that this is more important than whether or not we pass, some new potential, program. It's more important to protect the people and the existing programs and structures supporting our most vulnerable across the state.
Great.
Thank you.
Thank you, Senator Vargas. And that comes to the end of our questions that we had today. And so in our closing minute or two that we have left in our time, we wanted to offer you any closing thoughts, comments, or words of advice, or whatever you might want to offer to your constituency.
I appreciate you and the work that you do on behalf of your membership. That should go without saying, but I wanted to say it. And I really have tried these last 4 years to be as committed to my North Star when I first came in. It's not easy. I think elected officials come in and then we kind of lose sight of who elected us here and who we're accountable to and who my boss is. And I have 40,000 amazing bosses in my backyard, and those bosses expect me to not to stand up and fight for things. And I've passed about, let's say just this last couple of years, about 15 to 18 bills in the last year and a half. We've passed some housing bills to create better housing opportunities. We've increased public health funding because our public needs to make sure that they're meeting the need. If our public health departments aren't working effectively, we can't take care of our people. We increased funding to our federally qualified health centers who serve a really high need population across our state. 50% of the people they serve are uninsured, and the other 50% don't have enough insurance to cover, or they might have other needs that potentially create a problem for them. And then outside of that, we've worked on rate methodologies to make sure that we're keeping up, because our changing workforce in the healthcare system is a problem. And we need good people in these sectors. And it stems from everything from, not only our nursing care facilities and our long-term care facilities to our behavioral health and our mental health. All these things are not nice to haves. They're need to haves. That has been my North Star of trying to make sure we're implementing these things. And that's how we talk about it. And that's what I'm going to keep doing over the next 4 years should I get reelected. Because, and I recently lost my father to COVID-19, and I cannot tell you how many individuals over the age of 55 I have seen negatively impacted by this pandemic. And whatever the reasons are on why they may be more susceptible, that means we need to be taking care of our older population in the state. We just have to, because nobody should have to be questioning whether or not they have more of the services or resources they need to lead fully functioning lives where they can see their grandkids. And I just, you have my commitment to doing everything I can to make it easier for your members.
Thank you, Senator Vargas. And we do send our sincerest sympathies for your father's passing, and you continue to be in everyone's thoughts and as we move forward. So, and thank you for your dedication for what you do. We want to thank you again for taking the time to visit with us today. We wish you the best with your campaign, and thank you most importantly for meeting with AARP today. With that, have a great day.
Thank you all. Take care.
Thank you.